We can see then that Presidents Nixon, Ford, and Carter put forward several different ideas about how to try to expand coverage for the U.S. population. But none of their ideas took hold, certainly not on the scale that we had seen with Medicare and Medicaid. That left subsequent presidents with growing problems. Problems of increasing expenses for government programs like Medicare and Medicaid, and also problems of people still on the outside looking in without the coverage they needed to pay for affordable health care. Let's take a look now at what Presidents Reagan, George H.W. Bush, and Clinton did to try to reform the U.S. system. While Ronald Reagan was vocally opposed to Medicare's enactment in the decades before his presidency, his administration ushered through Medicare payment reform and program expansion. When President Reagan took office in 1980, hospitals billed Medicare after treating a patient and charged for services separately, a process called fee-for-service. The more services a patient received, the higher the bill, and charges for similar treatments could vary wildly across hospitals.
For too long, the federal government has had a blank check mentality. The hospitals simply filled in the amount they wanted, and then Uncle Sam, or to be more precise, the hard-pressed American taxpayer, paid the bill. Today, for example, Medicare payments for treating a heart attack can average $1,500 at one hospital and $9,000 at another, with no apparent difference in quality. Likewise, Medicare payments for hip replacements can vary from $2,100 to $8,200, and payments for cataract removal can vary from $450 to $2,800.
The Reagan administration modified the way that medical procedures were billed for Medicare beneficiaries. They focused on hospital care, which was, and continues today, to be the most expensive site of medical services. Hospital cases were classified into 467 diagnosis-related groups, or DRGs. President Reagan argued that this payment reform would bring down costs by eliminating incentives for hospitals and physicians to bill for every minute detail of each hospital stay.
We've already taken the first step by establishing a new method of paying hospitals under the Medicare program. Ever since Medicare was established in the mid-1960s, hospitals were paid pretty much whatever they spent. Giving hospitals a blank check resulted in costs that were rising out of control. Now, under a new program, hospitals are paid set rates. And if the hospital can provide care for less, they get to keep the savings. Now, this has successfully reduced cost increases while ensuring that the quality of the hospital care stays high. We're monitoring this new prospective pay system closely to continue to assure that quality is preserved while health cost inflation continues to go down.
Another reform that President Reagan pursued but never signed into law seems almost a forerunner of an element of the Affordable Care Act. In the Affordable Care Act, there is a so-called Cadillac tax on high-priced, broad-benefit health plans that takes effect in 2018. This is similar to a Reagan-era idea of limiting the pre-tax exclusion for employer health benefits.
We also propose limiting the current tax subsidy for high-priced health plans. Most employer contributions for employee health benefits should be tax-free because this encourages employee health insurance. Our plan would simply cap this tax-free treatment in order to correct the bias toward high-priced, first-dollar coverage.
Though not all of President Reagan's proposed health reforms had staying power, the DRG payment system did. It's been expanded and modified in scope, but remains in place today. As the baton was passed from Reagan to George H.W. Bush, health reform was a lower priority than many other pressing issues, such as a slowing economy and conflicts abroad. Nevertheless, President Bush seized healthcare reform opportunities late in his administration, naming it as a priority in his 1992 State of the Union address.
We must reform our healthcare system. For this too bears on whether or not we can compete in the world. American health costs have been exploding. This year, America will spend over $800 billion on health. and that is expected to grow to $1.6 trillion by the end of the decade. We simply cannot afford this.
Some of the policy proposals President Bush offered might sound familiar. He wanted to harness the early potential of health information technology to make people better healthcare consumers. He believed that individuals should be able to compare quality across providers. President Bush also wanted to extend a tax credit to low-income families to help them purchase insurance. For middle-class families who didn't have insurance through an employer, he suggested a tax deduction.
We will make health care more accessible by making health insurance more affordable. For low-income individuals and families, I propose a health insurance credit up to $3,750 a year to guarantee people, even people too poor to file taxes, the ability to purchase private health insurance. That will give these families a certificate or voucher to be used strictly for health care worth more than $300 a month. And they can use it to buy into the plan their employers offer, but they can never afford. Or they can shop for whatever private plan suits them best. That's the American commitment to choice at its best.
President Bush also wanted to protect individuals with pre-existing conditions. While he didn't suggest severing the relationship between insurance and employment, he did want to make health benefits more portable so individuals could change jobs without fear of losing coverage.
Under our plan, health insurers would have to cover all employers requesting coverage, and that coverage would be guaranteed. It would be renewable, and it would have no restriction for pre-existing medical conditions. It would also be portable, allowing workers to change jobs without fear of not being picked up by their new employer's plan. We would establish networks that would help small businesses purchase insurance and manage their premium costs. Our coordinated care provisions would reverse the upward spiral of health care costs, too.
President Bush's remarks also foreshadowed a recognition of the importance of prevention and coordinated care.
Coordinated health care makes creative approaches possible. It provides quality care at lower cost with an emphasis on, and we saw it right there, prevention. It's just plain common sense. We're better off keeping people healthy rather than treating them after they're sick. And just Monday, Lou Sullivan and I met with some leaders on our effort to improve infant health and immunization. And there's nothing that makes the case for coordinated care like seeing these healthy kids. Preventive medicine improves the quality of life for patients and certainly saves a lot of unnecessary expenditures. Coordinated care can work for all Americans, but it's especially important for Medicaid recipients. It ensures they get care when they need it, where they need it, and that they get it in a cost-effective way.
George H.W. Bush's first and only term ended in January 1993, without significant health reform achievements. But the national stage was set for the plan of the next president. As the first Democratic president elected in 12 years, Bill Clinton considered his election an opportunity for governmental reform. At the top of his list was health care reform. Just days after being inaugurated, President Clinton tapped First Lady Hillary Rodham Clinton to co-lead a new task force shaping the administration's health care proposal.
Today I am announcing the formation of the President's Task Force on National Health Reform. Although the issue is complex, the task force's mission is simple. Build on the work of the campaign and the transition. Listen to all parties and prepare health care reform legislation to be submitted to Congress within 100 days of our taking office.
The task force met with hundreds of stakeholders and experts to craft the Clinton Health Security Act, a plan intended to give all Americans a minimum set of health benefits, including preventive care and mental health treatment, as well as protections against losing coverage.
With this card, if you lose your job or you switch jobs, you're covered. If you leave your job to start a small business, you're covered. If you're an early retiree, you're covered. If someone in your family has unfortunately had an illness that qualifies as a pre-existing condition, you're still covered. If you get sick or a member of your family gets sick, even if it's a life-threatening illness, you're covered. And if an insurance company tries to drop you for any reason, you will still be covered because that will be illegal. This card will give comprehensive coverage. It will cover people for hospital care, doctor visits, emergency and lab services, diagnostic services like pap smears and mammograms and cholesterol tests, substance abuse, and mental health treatment.
In the fall of 1993, President Clinton and First Lady Hillary Clinton embarked on a series of speeches and rallies to promote the legislation.
There's still a lot of people that don't think we're going to get this done. You know, Roosevelt tried it, Truman tried it, Nixon tried it. President Johnson wanted to do it, President Carter wanted to do it. But we are going to get it done because things are different. Circumstances are more dire. It is more obvious to people that we must change. The system itself is hemorrhaging. Not only do 1 in 4 Americans find themselves without adequate coverage, at least at some point in every 2-year period, but about 100,000 Americans a month are losing their coverage permanently. It is hemorrhaging. We can't go on. But we have to do it right, and we have to do it right now.
But as time elapsed, opposition in Congress to the plan grew as it became more and more unpopular with the American people. In particular, an element that required employers to offer health benefits to employees was not well received politically. And despite a Democratic majority in both the House of Representatives and the Senate, the bill faced an uphill legislative battle.
If we want everybody in this country to have health care, we've only got 3 choices. We can guarantee coverage through the workplace, through private insurance. We can pass a tax and cover everyone, or we can decide what a lot of the special interest groups and the Congress, people in the Congress hope we'll decide, which is one more time, we just can't figure out how to do it. Every other advanced country with which we are competing for the future has figured out how to give all their people health care security. We have not been able to figure out how to do it. You know why? It's because the people who are making a killing on the financing of the system don't want us to figure it out. I say, give it to the people.
With opposition reaching a fever pitch, the Health Security Act was never brought to the floor for a vote. Later that year, the balance of power in Washington, D.C. changed as the midterm elections saw landslide Republican victories that gave them control of the House of Representatives and the Senate. With this shift in power, health care reform was not revisited until Clinton's second term with a much more limited health care reform effort.
The biggest challenge we've got right now is to fulfill the promise we made to the American people when we persuaded the Congress to put in the Balanced Budget Act of 1997 sufficient funds, the biggest increase in Medicaid funding since 1965, to provide health insurance to at least 5 million more children. There are 10 million or more children in America without any health insurance. We had the latest numbers indicate that 4.5 million of those kids are actually eligible for Medicaid. Now, most of you here know that when we passed this program, we provided for the establishment, state by state, of things that are called CHIPS, Child Health Insurance Programs, to provide health insurance mostly to the children of lower and moderate income working families that don't have health insurance at work.
The passage of the State Children's Health Insurance Program, or SCHIP, extended coverage beyond Medicaid to millions of low-income children. SCHIP became President Clinton's most lasting positive legacy in the arena of healthcare reform.